After months of bargaining, Kaiser Permanente proposed a two-tier pay scale to the Alliance this month. Two-tier wage systems consist of one wage grid for current workers and a second, much lower pay scale for new hires. It's not simply less pay for inexperienced new graduates. This separate, lower scale would leave future workers, even the experienced, forever below our wages and benefits. Barry Irwin and his daughter, UFCW Local 7 registered nurse Natalie Mason, have seen firsthand the damage two-tier can do.
Losing friends was probably the biggest part.
And then having to work with them.
And then having to go back and work with them.
And, it just really destroyed families, it destroyed friendships.
Just the environment was the hardest part. It just didn't seem like the old place that we hired into. It just changed completely. And it was quite adversarial.
Just, those snide comments all the time, and it doesn't go away because the two-tier's not going anywhere. Young people would vote for concessions that would have teeter-totter effect back and forth against each other, pitting sons against fathers, uncles.
One of the main things that really bothered me was in the cafeteria. Some of these guys would come in there and they've been working hard, and they were getting half the pay. And when they went through the cafeteria line, they'd have to ask the price of each thing. It was really heartbreaking. I got so tired of that, I stopped going to the cafeteria and started carrying a lunch to work.
UNAC UHCP registered nurse Monica Simano recalls in 2004 when her mom and fellow represented workers were forced to accept two-tier.
I remember she told me when they were asking members, to vote to strike, she didn't go out. She didn't go out to vote. She said she was just going to leave it in God's hands and that, everything would work out the way it should. But now she realizes that had everyone stood together and were more united, they wouldn't be in the situation they're in now. She told me, don't be like me. Mija, don't be like me. I didn't realize how this would affect my career. I didn't realize how this would affect just the work environment and her benefits now. She had no idea. To not get caught up in, well, this isn't going to affect me because I'll be on the first tier, because it will. It's going to affect everyone. And so to this day, she advises me, and when we're talking about what's going on, she's saying, you guys fight for this. Don't let them do what they did to us. They've been fighting this two-tier system ever since. We definitely want the company to be successful. We're not trying to ask for anything that is over the top, especially after what we've gone through and what we're still going through, what our patients are going through. We owe it to them to deliver the highest quality care and to continue to be the model.
You guys are at a better position than we were to fight this. And all you need is solidarity and you can whip it.
Stand together and don't let them divide you, because the minute they divide us, the minute they win.